What are the students doing now?
Primarily, they're doing a deep compression to the forearm flexors. It's really good for people with carpal tunnel issues and hand and wrist pain. It's a very deep tissue technique for the forearm flexors, and there's a secondary arterial tourniquet. When they use this, sometimes their tibia is very pointed. They kind of have to turn their leg to the side to get a softer piece of tibialis anterior. Also, I showed them how to use a pillowcase or a towel to kind of dampen the pressure so it's not so sharp. When you use this technique, make sure to warm them up first with your hands just to get a feel for what feels tight and restricted and dense towards the elbow. And you don't want to go into the antecubital space. I think it's what's called right here, the crook of the elbow. And then it's this arm, right?
Yep.
And then you just have some tenderness, so like some discomfort in here, or?
Yeah, and this side will go a little numb.
On the ulnar side? Okay. No real problems with your hands? Okay.
Yeah, nothing that's like injury yet.
Okay.
Just...
Lift your head for me. I'm going to replace this underneath. There we go. Is that pressure okay?
Yeah.
And again, not too much?
No, it doesn't.
Okay.
What are you doing right now, Albert?
I'm just warming her up and pressing into her forearm flexors. She said she had a little bit of tightness, sometimes discomfort in this hand along the side of her ulna. And I'm just working some of the musculature there. I'm going to use a deeper compression in a minute. I just wanted to warm this up first.
Thank you for your consideration.
Instead of just diving in. So, how many of you have problems with your hands? Me. And welcome to my industry. So, guess who thought they once had a case of carpal tunnel syndrome? Everybody. Your teacher. And I went to the doctor. I was working at Women's Center for Wellness. It's part of Women's Hospital where I was born. Goes back to my roots. I was born at Women's Hospital. Worked at Women's Hospital in their spa and was basically hurting my hands because they wouldn't let me do Thai. And I went in and they basically said, there's nothing wrong with you. You should probably not work as a massage therapist. So tightness in people's carpals, you can always go in and work the hand. You guys are pretty familiar with these structures. I mean, you've been work on yourself, right? A lot of people will have a lot of tightness in this junction between the thumb and the pointer finger. It's a good spot to work. But for a lot of people, your real bread and butter, you can come along and work the flexors. The radius and ulna are side by side. I had her scoot to this side of the table so I had some more mat to work on. On my mat, her hand would still be completely on the mat, right? But I can come in and what I was doing was just using a little palm pressure through here. This section usually of the arm is still really good to work, but it doesn't seem to have as much tension as this top portion. This top portion is thicker. It includes the forearm flexors and a muscle called Pronator Teres, which turns us into Velociraptor extraordinaire. So if I come in here at the top, I'm not into is it the antecubital space? Is what they call it? It makes me sound smart at parties. I like that. I'll go into this between the forearm flexors, and then sometimes I'll kind of mobilize just to see. She's not having a lot of tension here, but if they're having problems, usually with Pronator Teres, I'm supinating their hand, right? I'm opening it up. You're lengthening that while you deliver some compression. How's the compression there?
That's great.
Feels great. Okay. Once you've softened that just a little bit, just because I want to feel with my hands first, I'm going to use a bigger, broader tool. Now, if it's too sharp, I have a pillowcase. Bloop. I, again, don't want to be in the crook of the elbow, but if I come into this dense junction here, how's that there?
Oh, it feels really good.
Okay. Not too much?
It's almost too much, but it feels
Okay.
great.
Right there. How's that?
great.
Okay, so slowly what I'm going to do is I'm going to mobilize her hand just a little bit on my own. Think pin and stretch, right?